Aloha, and it's great to see all of you here on this Thursday, May 21st. This is the COVID Care Conversation brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health here on the platforms of the Honolulu Star Advertiser. Good morning, I'm Ryan Kalesuji.
And thank you so much for joining us. I'm Yenji Denise. This, of course, is a conversation that's brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. And it's a way for us to bring in experts and leaders in our community to talk about the response to the coronavirus here in the islands. Today, we have a very special guest. We are so excited to welcome Dr. Sarah Park. She is the state epidemiologist, and we are going to be talking to her about the kind of testing that has happened here in Hawaii, and also talking about contact tracing and what needs to be in place for us to do things like reopening tourism. Randy, we see your question right there. Testing, of course, is key for all of this. And so we're so excited to welcome Dr. Park to the program today. Before we get to her, of course, we always like to start with the numbers and another good day, Ryan.
That's right, only 2 new cases reported yesterday for a total of 643 positive cases since the outbreak began. No new deaths, again, remaining at 17. So the daily count of new infection has been in the single digits since April 18th and has not exceeded 4 new cases for the past month. So those numbers continue to stay low. And someone who has definitely been tracking these numbers is Dr. Park, who joins us live now. Dr. Park, good morning. Thank you so much for joining us and taking the time. We know that you are a very popular person here in the state of Hawaii with a lot of people asking for your time, and we appreciate you spending time to join us and the readers here this morning.
Sure.
First off, I want to just kind of get your general assumptions of where we are at right now as a state, looking at these numbers that we've consistently seen, and your overall, I guess, take on where we currently are at.
Yeah, so we've definitely gone over the peak of the first wave, but we're still not out of the woods yet because we still continue to see a few cases at a time. I rather suspect that we may continue to see that, because unfortunately there are some folks, while the vast majority of us are complying with the social distancing measures, there are obviously some folks who are not necessarily doing so. But that's okay, because I think that as long as the numbers stay low and all of us, as much as possible, continue to think about social distancing, or I should say physical distancing, really, and hand hygiene and all the other measures that we've been recommending, that we'll get out of this. And so we're in a good spot right now for Hawaii. And I think a lot of us, the whole community, needs to take credit for that.
How are we doing in terms of testing when we look at our community versus the rest of the country?
Yeah, it was definitely a struggle early on, and a lot of it had to do with a lot of the resources. A lot of it had to do with the fact that we were waiting for CDC to be able to share, with us what the test, the platform was and such. But definitely related to the resources, the reagents, all the different swabs, the what we call the PPE, the personal protective equipment. But the supply chain has stabilized now, and with that also our labs, both our public health lab as well as the private labs, have increased capacity. So we're in a very good spot in that at this time, the labs aren't even working at half capacity in terms of testing. That means that, if there is illness out there, if there's a patient that presents to a physician and that provider really feels that, based on what they know about their patient, they need to be tested, they can go ahead and order that test and feel like that test will be done in the state of Hawaii. And so that's a really good thing.
When looking at testing, we're hearing reports and some conflicting information about the accuracy of tests and how someone can take a test, be positive, or maybe show up negative in the testing. Can you explain sort of the process behind the whole testing mechanism and the fact that some people may be getting negative, although they are indeed actually positive?
Right, and it can go both ways. It can be a false positive, and it's actually truly you're negative. And so it really underscores these tests are not geared to be, perfect, and that they are not geared to just take the test and magically now whether you have it or not. They really need to be administered in the context of your symptoms, your history, your history in terms of who you might have been around. did you have any ill exposures, and really your underlying medical history as well. So it's really something that you have to do in conjunction with your clinical provider. And so a negative test, for example, can occur if someone didn't get an appropriate sampling. For these molecular tests, viruses are replicating or reproducing in your cells. So it's not like you do a swab, like you touch a surface and like bacteria and you can grow it on a plate or whatnot. With viruses, you actually need to collect some cells from the surface in the back of your nose, and so that swab is not really just a touch, it's really rub back there and get some cells. So what if someone did touch back there, but they didn't really get a good collection of cells? Or what if they got one good collection of cells, but it was not the right area where the virus was actually reproducing, where it was infecting those cells? So these kind of things could produce a negative result. Positive results can also occur, and it could be an issue with the lab testing itself, and maybe for whatever reason it showed up positive, and we've certainly seen that, and we retested because the history was somewhat suspicious, someone who had no symptoms, no exposures to anything, and we immediately retested that specimen in the public health lab, in our state lab, and it was lo and behold negative, which was more consistent with the whole picture. So it really underscores that when testing occurs, you really need to take into account the entire picture. And that's true not just for COVID, but for every disease out there.
We're getting some questions from the audience. Henry is asking, what's the biggest pattern for all these other states or countries that have experienced a second wave that Hawaii should follow? Now we're in a period where we are sort of starting to loosen up the stay-at-home restrictions. We've heard a lot about a second or even a third wave. What can we learn from others, and what are you expecting in our community?
I think it's really important, as I mentioned earlier, that it's really important for us to remember that even as we start to try to go towards a new normal, that we have to remember to wash our hands, to wear the mask when we're out and about, to be aware of when we're around other people's, and again, to think about that physical distancing, to be aware of that. I think also being aware of cleaning surfaces that are high touch surfaces. These are all things that really are effective. I mean, we've shown that it is effective, right? But we can't live the way we've been living forever, so we have to go towards that new normal at some point. And really, it is going to be more mindful, if you will, of, not touching our face with dirty hands, and hand washing on a regular basis, and not coming to work when we're sick. All these things that I know you've all heard me talk about with flu season. Really, it's just really now so much more important, I think. And I would comment that the interesting thing is that through all of this, we've also seen almost near disappearance of flu and other respiratory pathogens. So it really underscores that these measures we've talked about for so many years do work. We just need to start to normalize some of them and figure out how to work in the new normal with some of these measures.
Another question that we had come in had to deal specifically with, of course, this is a big topic, is the 14-day quarantine. And I know that you can't speak directly to the policy change, but one of the big questions is regarding people coming into the state and reopening for tourism. What would be your recommendation in terms of how we manage out-of-town guests and visitors coming back into the state while also trying to prevent it from entering the islands again?
Yeah, thanks for that question. I think I'd love to take this opportunity to remind everyone, if you really looked at, as we were reporting the disease activity with this first pandemic wave, what was really obvious to us, and hopefully as you listen to me, it's obvious to you, it wasn't the visitors that was driving our wave. It was us, our own community. And think about it, when the visitors come here, they want to go to the beach, they're, go to a luau, they go on a hike, they're doing outdoor things, they're by themselves, they don't really know people here for the most part, right? Whereas we go traveling, we come home, we give omiyagi, and we, have, get-togethers with other people, we're immediately, because our sense of community, we're immediately around everyone. And so it really means that as we open up in the future and we get out of this, we travel, we go visit friends, we go sightsee, we come back, we can bring it back home. And so it's really being mindful when we come home, of our health for the next 14 days after we've traveled, to be aware that, we should be washing our hands, we should keep our distance from other people. And and those of us who stay home also are mindful of that as things do open up in the future. The measures that are being provided, or guidance that are being provided to businesses now, are going to be really important. That guidance, for example, with restaurants, about maintaining, a certain amount of distance between tables, about having reservations, instead of just walking in and having lines where you're just, close to each other. So we're going to have to be mindful of that in this new normal. And one day, hopefully, there will be medications that can treat this disease, or a vaccine, or something that will help us get back to more of a normal life that we once had.
Ann Medeiros is asking, should high school students wear masks in a classroom, thinking about going back to school in a few months? We were lucky enough to have Dr. Christina Kishimoto on here last week, and she said that they are starting summer session with classrooms of 6 to 8 students. High school students, I know you could probably get them to wear a mask, but little kids, even not so little. I mean, I can't imagine a 6, 7, 8-year-old, even if they may be able to put it on in the morning, I don't see them keeping it on all day. What is your sort of sense of schools as we look to the fall?
Yeah, that's a lot of discussion that's going on around that exact topic right now. And I would say that our position is that, if we can maintain what we're kind of calling it Ohana bubble, where you know who your contacts are, and you're trying to be mindful of who you're exposing yourself to, and or you try to be consistent in those contacts from day to day. It's like your little family outside of your family, right? And then if you have that situation, that's a potential for not having that mask, but you still need to wash your hands. You still need to be mindful of keeping your distance from others outside your Ohana bubble. So that's one consideration that we're talking about. Certainly, as a pediatrician and as a mother, I worry that, if you put masks on kids, they're going to just touch their face. No matter how much you tell them not to touch their face, they're going to touch their face even more. And that actually potentially could lead to more likely to have contamination or infection, right? So that's something that we definitely need to consider. And then the more important thing for social development for kids, especially the young ones, but even also our adolescents. There's so much as you grow up in that those early years that's so dependent upon that social development, the interaction. And we don't want to have them losing that in that critical development period. So there are things that we are discussing in terms of how do we assure that, as we also assure their safety. The interesting thing to note is that kids, for whatever reason, still are not getting severe infection when they do get it, the COVID-19. They're oftentimes very, very mild infection, and very few of them seem to have any recognizable infection. If you look at even our numbers here in Hawaii, you'll see that, right? And so there's this lingering question of what is the role of kids in this pandemic? Are they actually driving some of the infection, and they're just sharing their germs as usual and we don't know it? Whatever the reason may be, we do know that kids don't seem to be getting the severe infection that we see in older adults. So
another interesting question that has come in from Joe asked about how many deaths from COVID-19 was COVID-19 exclusively without being related to other illnesses, because oftentimes in the reports that have come through, we've heard underlying health issues, has suffered from X, Y, and Z. Has there been any sort of casualty that has just been directly from COVID-19 without those other underlying causes?
There have definitely been some of the deaths where it's just definitely obvious that it was definitely COVID that contributed to the death. And there are others where there have been underlying issues, and it's difficult to know, would that person, if they didn't have those underlying issues, succumb to the COVID-19, or is it really the underlying issue that was the cause and or the leading issue, and COVID-19 kind of tipped them over the edge? And that's what we talk about, by the way, with flu deaths, for example. Flu, we know, and other pathogens, if you do have underlying issues, medical issues, and you're not well, you're not 100%, so you're kind of fragile to begin with, and then you get an infection. That infection can, cause your underlying condition to get even more severe and then you can die from that. And so that still counts as a death related to the infection. And so that's why it's really important for all of us to be mindful that, as much as possible to take care of our own health, and to also be mindful that there are people out there who are vulnerable, extra vulnerable to infections like COVID-19. And it's partly our responsibility to make sure we're healthy and not getting infected with COVID-19 so that we protect everyone else around us.
As the state does begin to open up, how much of an increase in cases are you expecting to see? I mean, we've had these single digits for, I don't know, probably about a month now, which has been wonderful to see, even some days with no new infection. But what are you expecting as we open up, and sort of, if as we navigate the world and we decide what we want to engage in, are there activities that you recommend against? I mean, what's your take on malls, restaurants, gyms, places of worship? How do you recommend navigating that?
I think at this point, it eventually, as we open up, we'll be able to engage more and more in higher and higher risk activities. And higher risk for, from our perspective, is really activities where you really have a lot more interaction with a lot more people. I don't think we're quite at that point where we will be talking about mass gatherings where people are really close packed into each other. That's just too high a risk of an activity at this point. So really, when you're engaging in any of these things, it's again mindful of that physical distancing with other people. If you're around people you don't know, wearing a mask can be helpful to protect them. It's not really protecting you so much as protect everyone else around you. So as long as everyone is doing it, we're protecting each other. But again, it's that hand hygiene, being mindful, not touching your face. And when you get home or when you get to a place where you can, washing your hands if you've been around others. So those are the kind of things to really be mindful of as we start to open up. As far as what we expect to see, I mean, it's kind of like being asked every flu season, where do I expect the peak to be? I wish I had that crystal ball, but I will say I won't be surprised if we do see an increase in activity and disease, when we start to open up, and at some point down the road when we start to see more travelers, going back and forth, and we expect that, and we're preparing for that. We've been preparing with looking at collaborating with the university for contact tracing programs to help ramp up staff here should we need it. And I would also point out that despite how crazy it has been this first pandemic wave, we still managed to continue contact tracing, unlike so many other states and jurisdictions out there who just got really drowned in everything. I won't say it was very easy at all. It was not easy, but we still managed to continue to contact trace and do what we needed to do to protect our community. So.
Well, I think on that, Ryan, if you would put up Benita's question, because we have low positive cases with contact tracing, have you been able to identify where the positives are coming from? And just as a background, really briefly, if you could explain to our audience what contact tracing is, because I know we hear all these terms, but everybody might not understand what that exactly means.
Sure, and thanks for asking that one specifically. So contact tracing is basically when we are identifying a confirmed case. The first thing an investigator will do is talk to that case, obviously interview that person. But in addition to asking about their illness and all their exposures, they'll ask them specifically, look at the calendar. They'll oftentimes even say, take out a physical calendar and look at when you got ill and 14 days before that, and tell us who you were face-to-face with, face-to-face contact. And then they'll start putting together a list with that person, and they'll do all sorts of things to try and jog that person's memory. Do you remember a doctor's appointment? Do you remember seeing any people for dinner or anything? So asking very sort of pointed questions to try and get more information. And once we have that list, those are the contacts that we've now just traced, the start of the trace. The second thing is then, after interviewing that case, is now we go and contact those contacts, communicate with those contacts, and we let them know that they've been identified as a close contact of a confirmed case, that unfortunately now that requires them to be in quarantine and to monitor themselves. And of course, we'll ask them, are you feeling okay at this point? Because, depending upon when they had that exposure, we need to know. And then from that point onward, we're monitoring them for the next, 14 days or so. And we'll be calling them twice a week. Now that we have what's called this health space application, we can even tell them we don't need to call you necessarily, but if you're willing to get a text message or an email, we can send you a quick health survey that you answer, and then we can quickly monitor you that way. So that's how we do the contact tracing. And I have to say, I forgot the original question now because I got into the contact tracing.
Yeah, the question was, will contact tracing, have you been able to identify where the positives come from?
Yeah, so that's a great question. And I wish, again, we had a crystal ball for every single person. What people remember as their exposures isn't always, and this is also true of other diseases, isn't always necessarily the exposure. And sometimes, despite, just really going through with a fine-tooth comb all the different potential exposures, we can't identify. And this underscores it's a respiratory disease. And just like flu, shouldn't be surprised that occasionally or many times with flu disease, we can't figure out who you were actually exposed to get the flu. So same thing with COVID is that oftentimes we may not be able to determine exactly where. Now, having said that, one of the things we've been working hard to do here is to build up capacity for what's called whole genome sequencing in our laboratory here in the state. What that means is to actually sequence out the RNA code for the virus for specimens. And we can't necessarily do this for every single specimen, but for certain ones we can. And by that, we're trying to contribute, first of all, to the world gene pool, if you will, the world gene library, to help the whole world understand, what's happening with the virus. But we can also then potentially try to look at family trees of the genes of these, the particular specimens, and see if anything really matches up. If they're closer together, that suggests that somewhere in time there was an exposure, a common exposure. If they're farther apart in the family tree, so to speak, then that suggests they weren't related. And in this way, we might be able to tell some of the origins eventually of, the virus. I suspect, though, with so many, I'll tell you, we had so many travelers, and especially, again, residents, a lot of residents who came back sick. From all over the US, but all over the world. I mean, you name it almost, we have probably at least one person who traveled to one corner of the world or other. And so it wasn't like we saw a contribution from one major area per se. It was pretty much scattered throughout. And it really shows, again, how interconnected Hawaii is with the rest of the world.
Renita Kim has a question. She says, please discuss the post-COVID-19 inflammatory syndrome in children that the CDC has issued an alert about. I know that the vast majority of children seem to recover relatively well, but there are these cases that, from my understanding, mimic Kawasaki disease. Can you talk a little bit about that?
Yeah, sure. There's still a lot that we don't know, and there's still a lot we don't know about this disease. But and this one obviously is a concern for me as well as a pediatrician and as a mom. Is a concern because, as I said earlier, kids generally don't get very sick with COVID-19 infection. But what we're learning is that very few of them, on top of that, will get potentially this disease. And what it looks like is it may be an autoimmune phenomena because it seems to be occurring, maybe at least a couple of weeks to maybe a month after their infection with COVID-19. That's what it's looking like. And when it occurs, it's getting this name of Kawasaki-like. And really why that is because they're having very high fevers out of nowhere suddenly. And they may have some other phenomena. They may have some rash that look like Kawasaki, but really is not. The high fever is really what is sort of making it very similar to Kawasaki. But the other thing is it's exactly what you hear in the name. It's a multi-system inflammatory syndrome. So basically your immune system going haywire, if you will, and suddenly you're fighting your immune system. and your immune system is attacking your other body systems, and we can see failure of your respiratory system or your kidneys or your liver. And the treatment right now we think is probably very similar to Kawasaki or Kawasaki-like atypical Kawasaki syndrome, and in that we're using intravenous immune globulin. There's some other medications that potentially could be used. Most kids are surviving from this, but some unfortunately unfortunately there have been a few fatalities. Fortunately, very few again, but still a concern. It just underscores it is a serious condition and something that we need to be on the lookout for. The other thing I'll mention is that unlike Kawasaki's, this seems to be affecting older children. So with Kawasaki's, we usually see it in the under 5-year-old group, but with this one, we seem to be seeing it in more of the over 5 and even adolescent or teenagers. So it's something for us to all watch. Fortunately, again, knock on wood, we've not seen it here in Hawaii, but I've sent out an alert to the physicians, and I know all the pediatricians are very mindful of this issue.
One of the debates that's happening right now is just the issue of testing and how much we should test and what sort of effort should be made on the testing end in terms of helping to prepare the state and reopen the state. What are your thoughts, and what is the state's recommendation on the overall testing model and what the state will be doing moving forward?
It's not really about testing so much as testing capacity. It's about making sure that our providers in the state, no matter where they are, can feel that, just like any other disease, that when they're confronted with a patient, they can order that test and not feel that there's going to be a holdup in getting a result, or they're going to have problems getting the test. And if you recall at the beginning of this, that wasn't the case, and that was the big problem. So that when a provider saw their patient and wanted to order the test, they couldn't. And we had to be really mindful because of all the restrictions based on FDA approval of how the test could be used, and CDC recommendations and such. And it's now at that point where providers can order the test. And I would also point out that a lot of times providers aren't just ordering, this one test. They're ordering a bunch of other things because they're in their mind. They're usually, when they see the patient, they're considering, well, it could be this, but it could also be this, this, and this. So they usually order a bunch of tests. And then, based on how those result out, then they make a determination on how to manage the patient. And that's the ideal. And that's the ideal we should be working toward. And, and we continue to try to make sure that that's a possibility for all our providers and thereby our community. And so it's really about ensuring our testing capacity. So having all the supplies that we need so that the laboratories can do the testing, and that our providers feel like they're protected so they can do the swabs, right? Because it's not just about ordering the test. In this case, it's, the providers need to be able to feel protected, have the mask, the eye protection and such, to be able to then take the swab and then send that swab to our lab. Or labs, I should say. Multiple labs now.
We know that you're incredibly busy, and so we just want to ask you for any closing thoughts. As we really appreciate your time as we head out, and again, as these restrictions start to lift. And we've heard about people are antsy. It's been 2 months of being at home. As we start to re-engage with the world, what is your advice to people? Any final thoughts today?
I would say don't rush to just get back to a normal life. Unfortunately, we will not be going back to the regular normal. It'll be that new normal. And that, Hawaii has been ahead of the game, and we all should feel proud. We should all feel like we can all take credit for this, because it really has been a community effort, because we can provide guidance, but we as a community have to embrace it. And going forward, as we start to open up, we can't forget all that guidance, all the recommendations around the infection control measures. So the physical distancing, the mask when you're out and about to protect others, washing your hands and keeping your germs to yourself. All these things are going to be so critically important as we move forward. And to remember that we eventually will start traveling and going out into the world, and be mindful of when we come back, and that we could be bringing something back. And so be mindful of that again. And I think that's, as long as we continue to pull together as a community, I think we'll make it out of this. But it is going to be I think we should be proud. I think that's why we've survived, is because of that sense of community that I don't think you see anywhere else in the US.
Yeah, definitely thankful for those low numbers. Well, we thank you so much for taking the time. Again, we know you're very busy and appreciate you taking the questions from the readers and from the viewers of the Honolulu Star Advertiser. And hope to maybe talk to you soon, maybe in a few weeks again, and get an update. But thank you and take care.
Thanks for having me. Bye-bye.
Thank you. Very interesting to hear from her, and reassuring as well to know that the testing capacity is there, and that interesting to hear that we're not even hitting half of the testing capacity that we have. That, of course, your provider has to order a test for you, so it's not just anyone can walk up and ask for a coronavirus test. But good to know that those tests are being processed here in the state. And she's right. I mean, in the beginning, people were clamoring for the tests and they couldn't get them. Now, at least there is the availability. And interesting also to hear her talk about the contact tracing that they're able to do as well.
Yeah, I think that's a point that often gets lost, is when you look at some of the other states that have sort of gotten overwhelmed by the number of cases that were coming through, that they just did not have the capacity to continue on with the investigation side of it. And she said that Hawaii has been able to sustain that and able to recommend to those who have come into contact with those positive cases to then stay in those 14-day quarantines. So interesting to note that, as well as her thoughts on just reopening the state and knowing that things aren't going to be normal for a while now, and this is sort of the new norm for many of us. We've heard her make that comment a few times, the new normal, which will not include these large gatherings anymore for the time being. So we'd love to hopefully have her back on maybe in a few weeks or potentially next month to sort of get an update as we begin. As she said, we're going to see more cases go up as things open up, as the state begins to open up once again, and them just trying to be able to monitor and keep track of all of that.
Yeah, and also the big question with schools. And I saw a lot of parents and other folks writing in about what are we going to do about schools and how we're going to make that work. And I know that's something that the DOE and the state is really looking at. It'll be interesting to see how summer plays out as they have these classrooms, as Dr. Kishimoto told us last week, of 6 to 8 students. Then do we see clusters of virus, and how that informs how we move ahead to the fall. But also what she said about little kids is true. If you throw a mask on them, they may be more likely to touch their face, and that might make it even worse. So, and speaking of the new normal, moving on to some of the other headlines in today's paper, the paper had a very interesting article about Oahu retailers and how they are trying to reopen and climb out of the slump of COVID-19. Even those that have reopened are not necessarily seeing the foot traffic or the sales that they need to stay afloat. Some of them just saying that staying open is basically a public service at this point, and that they're not really making any money, even though they have been allowed to reopen.
Yeah, again, especially here on the island of Oahu, where retailers were allowed to open on Friday, they said they saw little to no customers really entering their stores. Not a lot of people still feeling comfortable about getting to a point where they can go into some of these retailers. And a lot of them are just asking for lease forgiveness, as well as just some sort of help on the rental side so that they can sort of navigate through that, because they're having to deal with all of these other issues with pay and taxes, as well as payroll. So it's an interesting article, and it's definitely a difficult situation for anybody who owns a retail store here in the islands, of how do you reopen and how do you manage through the coordination of all these new requirements that are now required by these new state guidelines.
We know that it's a time of incredible economic stress for those retailers and obviously their employees. A lot of folks have been laid off. We've had, Scott Murakami comes on every Tuesday, and the unemployment questions are numerous, a lot of the frustration there. So with people feeling all of this stress and being cooped up at home, there's a lot of questions about domestic violence and the incidence of violence and stress at home. So tomorrow, Nancy Creedman from the Domestic Violence Action Center is going to be here. She's going to be talking to us about what they are seeing with their clients in terms of safety and what's happening with spousal abuse and child abuse, and also give us tips in the community about how we can help if we know someone who is in need, because they're stuck at home, and how dangerous that can be. So we really look forward to that conversation with Nancy. We encourage you to watch it and to share that wide in your network, because there could be someone that you might not even know who needs to hear that message.
Yeah, looking forward to having that conversation. Of course, we always like to end our show by highlighting some of the good things that are happening and some of the people that are doing good. And one of the organizations, of course, that is doing good has been the efforts that is being made by this campaign here, by the Hawaii Agriculture Foundation's Food A Go-Go campaign. And of course, they are supporting Hawaii restaurants, and they really are trying to encourage customers to consider this takeout menu and, takeout option with delivery and curbside pickup as an alternative means to providing meals for families in order really to support these local restaurants. So this Food A Go-Go website is free, and it's a community resource with like all the latest restaurant information and those that are open for takeout. And they've actually partnered with, some of the with the delivery service in Elite Delivery to sort of now they used to do valet service, but now they're doing, of course, food delivery. And so there's an easy way for people to get involved and to support the restaurants through this campaign.
Yeah, that's right. For the month of May, every dollar spent on a takeout or delivery order through the Food A Go-Go program with a Hawaiian Airlines Bank of Hawaii World Elite MasterCard, they're going to donate $1 up to $100,000 that goes directly to the Hawaii Agricultural Foundation's format to support local food producers and their partners. So you're helping local farmers, you're helping local restaurants, and you're getting some delicious food. So we encourage you to go there, go to the Food A Go-Go website, check out their list of all the restaurants you might not even know that are open, that you can't, don't traditionally do takeout or delivery, but they are doing it now. So we mahalo that program and really encourage you to try to support local businesses as much as you can. Where your dollars go really does matter right now.
Yeah, and it's just a really neat way how they've been able, again, we talk about it every day, how different groups of people have come together to really tackle different issues. And it's just really great to see that community coming together to help those in need, like our restaurants and including the agriculture community as well. So again, foodagogo.org. Also tomorrow happening, there will be another food drive with food donations that are happening. So encourage people to head on over to the food bank to have more information about that. And you can get more information about how to get food maybe outside even these donation centers, because they do have these other smaller donations that happen as well. So encourage you to head on over to the food bank for more information about how you can help maybe even donate food items, or if you are looking for support in that way as well.
Yeah, lots of resources there. And we really thank the Hawaii Food Bank for all that they are doing. They're doing that every Wednesday and Friday, that big food drop at Aloha Stadium. We saw the big lines. And Melanie is saying, is there a recording of this interview you can watch? Absolutely, yes. As soon as we get off, then the program archives, and you can watch the whole thing, and you can watch Dr. Park's interview along with all those other interviews. If you happen to have some unemployment questions, Scott Murakami, again, is every Tuesday, and he answered a lot of questions this last Tuesday. Again, Nancy Friedman is tomorrow, so we're going to be talking about the impact of domestic violence, the impact of COVID when it comes to domestic violence, and we really encourage you to watch that program and take part in that conversation tomorrow. So until then, we wish you a very fond aloha. Stay safe out there and take care of yourselves and one another.
We'll see you tomorrow. Aloha.